Welcome back here at 9:20 on Live Impact News. I'm Jane Monreal, and this morning, tech innovation and artificial intelligence are changing the way we interact with so many things, right? Services, including healthcare. Joining us this morning right now is Amy Jordan. She's the Vice President of Consumer Experience at United Healthcare, helping lead the charge with digital tools, including AI, and hopefully making it easier for patients to shop, compare, and manage their insurance coverage. Amy, thanks for joining us this morning.
Thank you so much for having me.
So let me start with the big picture. What are you seeing in terms of how people are interacting with their health benefits? Are they confused, overwhelmed? What are they feeling?
Yeah, I do think, unfortunately, there is some confusion right now with the healthcare system. I think a lot of people feel overwhelmed. They feel like they're not quite sure what benefits they have or how to use them. And then obviously, we all know that there's a current trend of rising healthcare costs that's really disconcerting for a lot of people. And so, overall, what we see because of all of these things is a delay in preventative screenings, a delay in seeing primary care physicians, which ultimately can lead to problems down the line. And so, we're really focused on bringing forward technology and resources to really make it easy and eliminate a lot of that uncertainty and that burden for our members so that they feel confident in their decisions.
And so how is AI beginning to change how we experience our insurance benefits?
Yeah, I really feel like technology and AI is the great simplifier of healthcare and the complexity that comes with it. These tools and resources that people now have access to really empower them to make informed decisions. They can find providers that are in network, they can understand their costs, and they're really able to feel confident about going into the healthcare system, asking the questions that they need in order to really make the best decision for themselves.
And so what does this AI-powered tool specifically do? How does that work?
Yeah, so there's a lot of different AI tools that we're bringing forward for our members. We're really focused on the navigation of care space right now. And so for us, that looks like bringing forward a provider matching tool called Smart Choice, which matches our members with high quality, low cost providers based off of their benefits and where they are in their location, and really making sure that they understand where they can go find that high quality care. That's one resource that we've been focused on. Another is really bringing forward these AI tools like our Avery personal assistant, which is really there to answer any question that a member might have 24/7 and give them the information that they need as they're looking to answer the questions or engaging with a physician and know where to go from there.
Yeah, one of the bigger frustrations for patients is that cost transparency. How does this technology help in that arena?
There's a couple of ways in which cost transparency is addressed. We have great tools nowadays that allow members to come in and actually look up those costs ahead of time. And so we display the exact rates that we have with those providers. It looks at where the member's at within their plan to understand if they're paying what the cost they might be paying, if they're paying a co-insurance rate or if they're paying a deductible amount. And so they can really feel comfortable in understanding what that cost might be ahead of the visit. And so it's a great new tool that's kind of come around in the last couple of years, and we're working on perfecting it so people can feel confident in the number they're seeing.
It sounds pretty good for the patient, beyond the patient themselves. How about for the broader healthcare system? What does that look like?
So obviously our providers also are getting this information from us because sometimes for them there's a lack of certainty in reimbursement. Obviously they're doing their best to try and provide the care that they need. Our members are looking to find that care, and everyone's trying to understand that exchange of dollars. And so providing those transparency tools both to our members but also that information in real time to our providers gives them an ease and understanding of how they're going to get reimbursed. And so they're not spending their time with some of those administrative tasks but can really focus on the patient care.
All right, Amy, anywhere we can go to for more information?
Yeah, if you're a United Healthcare member, we encourage you to download our app. Otherwise, you can go to uhc.com to learn more.
All right, Amy Jordan from United Healthcare, thanks for bringing us that insight. AI helping us navigate some of these systems a little bit easier, hopefully. Time will tell, certainly. Amy, thank you for joining us this morning.
Thank you for having me.